remarkably. I'm an infectious disease wound care and obesity medicine doctor who's certified in these areas of healthcare delivery in this complex healthcare. Our target is improving patients' overall health with a comprehensive approach in healing. And here we're presenting a case where we have prevented amputation not just from using infectious disease techniques, but also advanced wound care techniques and also metabolic health techniques. So I am located in Georgia in the markets of LaGrange, Newnan, and Augusta. And this is my website and also social media contacts. Our approach is nothing but real food as medicine in removing barriers to healing for tsunami of chronic diseases. Wound care is complex. Wounds are causing major problem with morbidity and mortality in our health system. And there's multiple burdens in wound healing, including the fluid matrix dysregulation, cellular aspect, bioburden, and also angiogenesis impairment and hypoxia, malnutrition, and pressure. In the patient here that I'm presenting, we worked on his nutrition, pressure, infection, and IV antibiotic therapy, and also appropriately changing his nutritional status and removing barriers to his wound care. And this is 47-year-old male who's been hypertensive and diabetic since 2007. He had peripheral vascular disease following vascular service, ended up having injury in April, and his podiatrist from Alabama sent the patient over for further evaluation to our care. But unfortunately, we were not involved in his care during the hospital stay. But he ended up having surgical IND and foreign material removed. Unfortunately, cultures were not sent. He ended up having tenosynovitis, short 7-day course of IV antibiotic that was switched over to oral quinolone and clindamycin, and sent home on DPP-4 inhibitor and also long-acting basal analog Digludec. He's finally presented to the vascular service after surgery, but because of the nature of the wound and odor from the wound, he was asked to be evaluated by outpatient infectious disease service, and he saw us on 5/12/2022. Ended up, we did a debridement on his ulcer bed and started him on ivizocin. If you start, his weight was 285, and with improving and simple techniques that we taught him, he's lost his weight. He lost around 29.2 pounds of weight, and he's off his Diglutec, and he's only on sitagliptin, and his body composition also remarkably improved. As you can see here, his hemoglobin A1C at his April 21st presentation to the hospital was 10.3. His creatinine was 5, almost going into dialysis at 6.3, and ended up his protein to creatinine ratio was also urine protein to creatinine ratio was 193 and has improved now to 241. And also his hemoglobin A1C came down from 10.3 to 5.9, and his eGFR came down, up from 14 to 53. So his creatinine improvements and creatinine calculated eGFR are also noted here. So his initial presentation to the emergency room on April 21st, like that, with the infection tracking medially. And as you can see on his presentation on May 12th, the same was noted, and with a forceps going towards medial aspect with undermined and tunneled area, basically. And the tissue was kind of not healthy looking, if you see the color of it. And slowly but steadily, we did cultures, IV antibiotic therapy, and once we thought he stabilized a little bit after 10 to 12 days of IV antibiotic therapy here, we started splinted cushioning, wherein we put a cast material on the bottom of the foot and offloaded the foot, used high absorbent dressing on the bottom of the foot, and essentially cleaned out the rolled margins, and slowly but steadily improved his healing with offloading and nutrition. And within 11 weeks, he went on to heal. So if you see his initial presentation, his waist circumference was 56 inches. His It has improved by 3 inches. His weight was 285 initially, then went down to 259, and BMI was 43 and improved to 39.4. And we were then able to do body composition analysis, and his lean body mass improved. His lean body mass was 137 here, and his body fat mass was 122 with excess body fat mass of 98.5 pounds. He still has a long way to go, but his BMI has improved to 39.4 and 39. And basically, he was gracious enough to give an interview. Please see this.
Hi, Frederick. How are you?
I'm doing well. How about you?
Good. Thank you for coming today. So it looks like we had some significant improvement, and we saved your foot for now. And can you tell me what happened to you, Frederick? How did you come about, or what happened to your foot?
Okay. Basically, we had some roofing work done at home.
Lovely.
And the contractor came back the following day to finish cleaning me up.
Mm-hmm.
But he didn't have any help, so I got there and helped him. And in the process of it, 2 nails got stuck in both feet. One got stuck in the left and the right. The right had damage.
Mm-hmm.
And later on that day, I ended up going to urgent care in the state that I'm from.
Mm-hmm.
They looked at it and they said I probably needed to get IV antibiotics.
Mm-hmm.
But they didn't have it there at the facility, so they recommended me to the local hospital to go to the emergency room.
This was in Alabama.
That's right. I went to the local hospital. They looked at it. They gave me a tetanus shot, and they gave me some just some oral antibiotics. In the meantime, I had an appointment set with Dr. Rona Green.
Yeah. Podiatrist. Okay.
Yeah, podiatrist. And she looked at it that following Monday, and she said that I should have been in the hospital. She didn't like the way it looked. But then she said she looked at the antibiotics themselves. She felt like they were weak, so she gave me a stronger.
Yeah, I think that's when she contacted me and
Right.
the vascular doctor, Dr. Rajiv.
That's correct.
And then you were sent over, and that was around April 20th, if I remember well.
Right.
And then you ended up in the hospital.
Yeah.
But then I did not get to see you for whatever reason.
Right.
And then we ended up getting you discharged. Finally, you ended up coming to see me sometime really in May.
Right.
In the middle of May.
Right. And what happened was that I had a follow-up with Dr. Rajiv, and his nurse practitioner saw me, and she asked me at that time, was anybody taking care of the foot, the wound? And I told her at that time there wasn't a follow-up until I was supposed to see the surgeon that went in my foot, and that was maybe 3 weeks later. And she said, we have Dr. Kamapali here that could help. And so I made the initial appointment, and that's when I really started seeing you.
So basically, tell me how you felt when your foot was infected. What was your feeling?
Well, at first, I felt like, I've had foot ulcers before. And, I just felt, I'll get over it or whatnot like that. But I will say that initially after they did the surgery, and I saw my foot right after that, and I saw the amount of drainage and stuff like that, and the side of my foot was swollen, and I could see the drainage switching around. It kind of made, I started to worry. I won't lie about it. I really started to worry because I never seen my foot swell up like that.
How many years have you been diabetic?
I've been diabetic for about, I want to say about, from the time I got diagnosed, I want to say about 13 years.
13 years. And then, so have you gained weight or?
Yeah, I will say over the last year, I've gained a good bit of weight because at one time I was down to I was down to maybe 254. But due to bad diet and whatnot like that, I had come back up to 280, 286, 285.
What medications were you taking?
I was taking Januvia and I was taking Tresiba.
Before this whole thing, when your sugars were high, were you on insulin?
Yes. At first I was on, before they switched me over to Tresiba, I was taking,
This injectable.
Balagar.
And then basically, how did you now get off a lot of your insulin doses?
What helped me to really get off the doses was, when you introduced me to a different program, about my eating habits, because, you started to discuss, while you were treating my foot, you started asking me questions about what was I eating, and I thought I was eating healthy when I was eating stuff like oatmeal, cereal and milk, a lot of the fruits and whatnot like that, and, you stated that those are not, conducive for you getting better. And, you stated you wanted me to eat more protein, eat more meat. And you gave me like a list of, a green list of foods to eat and foods not to eat.
Yeah.
And I started to follow that, and I began to notice that even without the insulin, because there was a time when my blood sugars, like even when I wake up in the morning, fasting blood sugar used to be like 225.
And now how much it is?
Now it ranges from anywhere from 95 to maybe 117.
Yeah. So basically, here is your thing. Your breakfast, before breakfast, you in the morning it's 1:08, 1:12 at lunch, and 1:35 at dinner. Really, you're not using any insulin at this point.
No.
So that's amazing. So now, you had a big hole. I'm going to do a presentation and take your pictures to show. And how did you feel the healing rate? It's we really started taking care of it in the last 2 months. This was the middle of May till end of July. In 2 months, less than 2 months, we got it healed up.
Right.
How is your understanding of the whole care? Do you think sugar had anything to do with your foot?
Yeah, it had a lot to do with it.
And do you think that your change in nutrition helped heal it?
Most definitely.
Okay. So are you going to go back to the old lifestyle of eating oats and a whole lot of different foods? So there's still a lot we have to do. We have to increase your muscle mass. We will do a body composition test for you. And there's a whole lot of things that we have to improve so that you be the right person you are.
Right.
I'm so happy for you. Anything else you want to add?
The only thing I want to add is that, I'm very thankful, to being in your care, because my stepdad, maybe back during 2020, 2021, he had lost circulation and whatnot, and he had foot problems. Yeah. Unfortunately for him, he went through this whole ordeal, going back and forth to another wound doctor, countless amputations.
Yeah. And
then eventually, his leg got amputated just below the knee. And so that was in the back of my mind too.
Yeah.
But I'm thankful that.
So basically, what we do is we work on preventing amputation. We call it I prevent amputation mode. So we are, along with vascular, along with podiatry, along with surgery, along with the heart and vascular team we have here, along with infection and wound care, and also nutrition. We are trying to develop a program that empowers the patients like you to do the right thing, along with offloading, nutrition, and really active wound care. Okay? And thank you for trusting us.
All right, thank you so much.
Thank you.
So basically here we had a patient who has had significant problems with his diabetes for more than 13 years and ended up with his current problem. So what I would say is even before diabetes, he possibly had pre-diabetes for 10 years before that. And now he ends up with all these complications. Apart from taking an approach wherein we take care of infection and wound care, I think metabolic health has a huge impact. What we followed with him is a simple technique wherein we cut down the carbs and make sure that we monitored his blood sugars and also cut down his medication when that was being done, and also use simple techniques with increasing protein and doing something called as intermittent fasting. This was a study, 6 month period, proof of concept study for diabetic with diabetic nephropathy that showed that 10-hour time restricted eating helped in improvement in blood pressure and atherogenic lipids in patients who had metabolic syndrome. So basically, also, this is another study that was published in Cell Metabolism, wherein a 10-hour time-restricted eating did help improve the criteria for metabolic syndrome, which are here in blood pressure, glucose, triglycerides, HDL, and waist circumference. If you have 3 out of these, it is called metabolic syndrome. And 10-hour time-restricted eating helped all this. So what by this presentation, what I'm trying to bring to the front is a comprehensive approach that involves care delivery modeling for the complex patients we deliver in a team-based manner, and developing that team, developing the process, developing readmission prevention approaches is what we in our practice are focusing on. And thank you for your time.